I've been coming here all my adult life, over 45 years, and I love my doctors. I love the medical assistants that work with them. I feel like it's a community and family. They're part of my family.
The experience I've had is excellent, from beginning to end.
Me encanta la atención de la clínica para mí y para toda mi familia.
I love to serve people. I think I was born to do that.
East Boston Neighborhood Health Center first opened in 1970 in the East Boston community, where excellent health care was unaffordable and far away. Opening with a handful of doctors and nurses working in pop-up clinics, we served the mostly immigrant East Boston community.
I was born a couple of blocks from here. I'm first generation Italian. I remember taking my mother to Boston City Hospital just as a little kid on the train. I was her eyes and ears, and I spoke to the doctors, and she was fine, but who knows, some others might have fallen through the cracks.
In the 1960s, access to healthcare was not a right. Because of the geographic isolation of residents that lived here in East Boston from the core of Boston, there was a gap here in this community.
Inspired by the civil rights and health center movements, our founders believed that everyone should have access to high-quality healthcare, regardless of the ability to pay. The South End Community Health Center, sharing a similar legacy and mission, joined forces with East Boston Neighborhood Health Center in 2020. Together as Neighbor Health, we've expanded our reach and impact across Greater Boston, serving more communities than ever before. With modern facilities, new patient-focused services, and leading-edge technologies, we've broken down barriers to access and equity.
We have primary care services. We operate a pharmacy program. We operate the state's only satellite emergency facility in East Boston. We've introduced new services like our behavioral health urgent care service.
The health center connects the patients with resources in the community, housing, clothing, transportation, vouchers for daycares.
I think it is helpful to be able to have care right around the corner from your house.
When I came to this country, it was very hard for me to get the required school physical at other healthcare facilities. We came here to the health center where I was welcomed by a doctor that actually spoke Spanish.
They embrace and care for the patients regardless of age, race, ethnicity, background. And I think that's what promotes quality of care. We met a patient who came from Honduras with no family, no money, and she was pregnant. She didn't know what to do at that point. Because the health center supported the patient, she's so happy with the health center.
Today, Neighbor Health serves over 120,000 residents, but we're still about community and providing compassionate care. Neighbors helping neighbors.
Coming to Neighbor Health as a new immigrant gave me the passion that I have to provide interpreter services to patients that have similar situations when they come to this country and they do not speak English. Our patient population is so diverse that we are able to provide care in about 43 languages on an annual basis. 70% of the patients that come to visit us prefer to get their care in a language other than English. It's critical to help our non-English speaking patients and new immigrants to make sure that their voices are also heard.
Neighbor Health has come a long way since our makeshift offices in 1970. We've grown, and met many wonderful new neighbors. We've had our share of challenges, but who we are has never changed.
Our mission remains the same, to provide high-quality healthcare services to all who live and work in our area. Neighbor Health reflects that continued commitment to our neighbors, but also a recognition that we've continued to grow as an institution.
We are neighbors helping neighbors to live longer, healthier lives.